All right, Chuck, you're ready to go.
Okay, we'll go in just 1 second. I'm just getting one thing set. Okay, welcome everyone again to our regular Friday media call. We will talk about all things having to do with COVID-19 and relating to the city of Bloomington, the Monroe County, IU Bloomington, and IU Health. Mayor John Hamilton is here with us as always, as will Monroe County Commissioner Julie Thomas, IU Health Regional Director for Alignment and Integration, Mary Ann Valenta, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and Indiana University's Assistant Vice President for Strategic Partnerships, Kirk White. We'll go for opening remarks to Mayor Hamilton.
Thanks very much, Chuck, and thanks everybody for being here. It was just a week ago at this session where we were talking about the upcoming march, and I just want to note the rally and march that was held last Friday afternoon was a very powerful day for our community, a demonstration of caring and activism, the likes of which we actually haven't seen in terms of scale in recent history. I want to note in the COVID world, the mask participation was huge. I would say over 90%, 95% or so from my vantage point, and we really appreciate that. Physical distancing, not so much. So we're keeping our fingers crossed that gathering of thousands of people focused on improving our city and our country won't cause a COVID reaction. I just wanted to note that briefly, and I'll return to that in a moment. Of course, we're moving to stage 4 today. I'm sure we'll hear more about that from Ms. Caudle and others, but I will note that the parks, about 24 parks and fitness centers actually are open now. Our Parks Department was getting ready for this. So those playgrounds at the parks, about 24 of those in fitness centers are open today. They've been disinfected, and we'll still keep signs encouraging distancing, but those are available. But basketball courts are also available, and sports leagues are beginning their practices. Of course, with stage 4, with the exceptions that we have with the increase in offices and stores and dining capacity, we also see the allowed opening of bars and taverns, movie theaters, et cetera. And that will be of concern as we watch that. And I'm appreciative that we continue to keep the social gatherings at under 100. I want to also just very briefly thank the 2 working groups on behalf of our whole community that have focused on economic stabilization and recovery. They've now put out about $1.5 million in support for local businesses and organizations and into recovery planning. Just a couple quick examples of that. Final approval is still pending, but we expect changes in signage rules to actually let some of the businesses, as they reopen, to communicate a little better, loosening up on size, fees, location, and number of signs to let the businesses get their communications more directly to people through the next couple months, as well as a week from today, pending final approval from City Council, but expected, we're going to do a pilot to close Kirkwood Avenue on a couple blocks between Grant and Indiana, to allow the restaurants and facilities there to use the sidewalks and parking areas for expanded outdoor dining activities, turn the street into the sidewalk for the weekend to see how that goes. Check it out. Kirkwood's got a whole new remake on it. So we'll look forward to that. I also want to thank the Social Services Group, which has continued its great work to support the fundamentals of shelter, food, childcare, and personal health. So let me just return back where I started, which was with the rally and the notion and the awareness of pressures and changes on all of us to keep reviewing what we do. I will encourage folks, if you're interested, there will be a Board of Public Safety meeting this coming Tuesday at 5 p.m. To consider all these issues of public safety. And welcome everyone's participation in that. The more we know about all that's happening, the better. So looking forward to stage 4 and hoping it goes smoothly. And Chuck, I'll hand it back to you.
Okay. Thanks very much, Mayor Hamilton. Let's go next to Julie Thomas.
Thank you so much, and thanks everyone for being here. I do want to let everyone know that all of the county parks, facilities, and trails are open except for the following: the splash pad, drinking fountains, and the small playground at Karst near the soccer field. Some restrooms are closed, but there are restroom facilities available. I also want to update the community that we have granted 27 businesses in the county that are involved in tourism-related industries. We've granted them $265,000. Also, beginning on Monday, county buildings that have been closed to the public will be open, but by appointment. So if you need to reach out to a particular department, please visit their website or give them a call for instructions and further information. Also, beginning on Monday, our board and commission meetings will resume on Zoom only for now. Also, I'm pleased to announce that we've been working with the County Council to provide $100,000 in additional funding to our township trustees. The moratorium on rental evictions and on utility shutoffs is going to be ending in July, early July. So we're working to try to ensure that the townships have the funding they need to assist our area residents across the county. Also, a big thank you to everyone who's been wearing their face coverings, including at the rally on Friday, which was an amazing, powerful event. But we do want to remind residents to please continue to wear face coverings out in public. And it is a sign of kindness and caring and respect for others in the community. So please continue to do your good work so we can continue to loosen restrictions. We're very hopeful that this county has been so thoughtful, county residents have been so thoughtful about this, that we're going to be able to continue on this trajectory of loosening restrictions. And with that, I will wait for questions. Thank you.
All right, thank you very much. Next, go to IU Health and Marianne Valenta.
Thank you, Chuck. I have a couple of topics to share from IU Health this week. One is regarding the easing of visitor restrictions, and then the other, what you might expect as far as us continuing to be very cautious about this pandemic and this virus. Starting Monday, June 15th, Indiana University Health statewide will be relaxing some of the temporary visitor restrictions that we put in place at the beginning of the pandemic. The revised guidelines do allow for 1 visitor per patient per day in inpatient areas. Each visitor will be screened and given a mask, which must be worn at all times within the facility. We will continue to not allow in-person visitors for COVID positive or COVID pending patients. I want you to know that we also consider exceptions to these guidelines on a case-by-case basis. In addition, the visitors must be 18 or older, and I will say we've seen an increase of parents bringing their children to the facility that are under 18 years old, and so we would request that you comply with the over 18 only requirement, please. Visitors to the outpatient areas, the emergency department, our primary care clinics, and other physician offices will evaluate the visitors on a case-by-case basis, depending upon the need for someone to have a caregiver or liaison with them, and so we don't have just broad guidelines for those. As far as our additional steps to ensure the safety of our patients, you will continue to see our providers and patient-facing team members wearing masks and asking you to put on a mask as well. We will provide those to our patients and the visitors at no cost. Social distancing will continue to be encouraged. We are redesigning spaces throughout the facility, including our waiting rooms in our outpatient areas and inpatient areas. We want very limited waiting in the outpatient setting, and so we continue to revise processes to achieve that. And then in addition, we have enhanced disinfecting procedures throughout all of our facilities, and we will continue to do so. Thanks, Chuck.
All right, thank you. Monroe County Health Department Administrator Penny Caudill.
Good afternoon. Thank you very much. Several updates today, and I will just start with some of the data and information that we continue to look at on a regular basis. So nationally, levels of influenza-like illness and COVID-19-like illness, the percentage of specimens testing positive for the virus that causes COVID-19 do continue to decline or remain stable at low levels, and that's nationally. Mortality attributed to COVID-19 also decreased compared to last week, but does remain elevated above baseline, and it may increase as additional death certificates are processed. In Indiana, the ICU and ventilator capacity in the state holds steady at good levels, and that's also true in our local region. Testing has been increasing. You've heard us talk about that week after week, and we can see that while we're having some increase in positive cases, that our testing in our community is also increasing. Today, when we look at the dashboard, we can see that we have a total of 185 cases so far, 18 deaths. 4,557 tests have been done in Monroe County, and that gives us a 4.1% of those have been positive. So the percentage of positives among the tests that's being done continues to be low. And when we look at the state level, the state rate as of today was 11.7% of the tests were positive that were conducted. So this, as a state, those numbers continue to decline. So those are good numbers that we've been seeing. Testing sites in Monroe County include IU Health, of course, the hospital, Monroe Hospital, CVS, and the OptumServe site that you've heard me talk about frequently. The OptumServe site as of March, as of June 3rd, had tested over 600 people locally. Statewide, they've done over 34,000 tests, and the number of positives has been come in at 4.94%, so just under 5%. While appointments are required at the OptumServe site, they are very easy to schedule, and most days you can get a test that same day. You just need to register. You can do that with the website at the state level, but directly it is lhi.care/COVID testing. And the link can also, as I said, be found on the ISDH testing page. So if you're interested in other sites or other places, you're looking for a drive-through site, all of that is listed on that map on the State Department of Health's website. There is a current push to ensure that all healthcare workers, long-term care, home healthcare workers have the opportunity to be tested. There's a push to get testing done for everybody in that category by July. And some of the lesser used Optum sites are becoming mobile in order to assist the state in meeting that goal. As I said before, we have seen some new cases in our community. However, we've also seen increased testing in our community. So given that the COVID-19 illnesses, the influenza-like illnesses remain low, that hospital capacity remains steady, testing is increasing, that we have contact tracing available, these are all good indicators for us to be able to continue to move forward. As we look across the country, though, we see some increased cases, and that reminds us that slow and steady movement is best. So that is why we do want to move forward, but we are still trying to take it slightly slower than the state of Indiana. Dr. Sharp did issue a new Monroe County health order yesterday that does move Monroe County forward into stage 4 with the state with only 2 deviations. Social gathering size limit will move locally from 50 to up to 100, and that is less than the state maximum of 250. So locally in Monroe County, that gathering size becomes 100 as of today. Bars and nightclubs may open, and restaurant bars may open at 50% capacity per the state order. since the bar service area usually contains items that could become contaminated, we have locally included a requirement for seating or service at the bar. These bar supplies must be protected from possible contamination by a patron that may be sitting at the bar. So a bar may decide to not use bar seating. That would be a way to maintain that protection, or they may simply put in some other control measure to protect those supplies. While local authorities may be more stringent than the state or the governor's order, we may not be less stringent than the state. So there are things like required masks for food service workers that are in that state order. I know people are frustrated by the short notice on changes, and we share that frustration. We do not get any advance notice from the state or from the governor's office. We learn about those changes the same time that everybody else does. So it does take us a little time to review those details, finalize the next steps for us, and then process those documents. So we appreciate everyone's understanding in the process so that it's not an immediate turnaround time. Some items in the new executive order that Governor Holcomb issued are worth noting, and I want to just kind of go over those briefly. Again, face coverings are recommended. That's not a change. Hospital visitations are encouraged with precautions, and we just heard that the hospital is doing that. Professional office building employees may resume work at full capacity. Retail stores and malls may open at full capacity. Dining room food service may open to 75% as long as social distancing is still observed. Bar seating in restaurants, we just talked about that, is 50% capacity as long as social distancing is observed. And then we did have our additional requirement with that. Bars and nightclubs can open at 50%. Again, bar seating, the restriction that we have. Movie and theaters, bowling alleys, similar facilities may open at 50% capacity. Something that I do want to really focus on here is non-contact community recreational sports leagues or teams may resume games, leagues, and tournaments on June 12th. Contact community recreational sports leagues or teams, private or public, may resume games, leagues, and tournaments on June 19th per the governor's order. When hosting or sponsoring venues let me back up because I want to say this correctly. They can do that on the 19th when they have submitted to the local health department and posted publicly a COVID response plan that includes precautions in place and being taken to ensure overall protection of competitors, coaches, officials, staff, and spectators. Such plans must be submitted 72 hours in advance of the event, and social gathering limits must be followed. And that is per the Executive Order 2032. So there is information for organizations in the guidance from the governor's office on how they can prepare those plans. And they just need to be submitted so that we know what is being done. And if there is a problem, we know exactly how we can assess what may have went wrong if we have an outbreak at a facility. Venues, in terms of activities, venues like convention centers may open at 50% capacity with adherence to social distancing guidelines. Playgrounds may reopen, but we do encourage people to remember that they need to wash their hands, that they need to use hand sanitizer frequently, avoid eating on the playground, those kinds of things. Conventions, fairs, festivals, parades, and similar events do remain closed. So just wanted to go over some of those things while we're talking about that. Schools are planning to reopen, and they're putting lots of effort into those plans, and the health department is working with schools on those plans. The Department of Education did defer a lot to the local health department. So we will be working together with everyone in our community, maintaining diligence and precautions so that we can avoid a surge that requires future closures or restrictions returning. Of course, county offices will reopen by appointment next week. We've already begun in the health department rescheduling those appointments. Our field staff will do most consultations and meetings on site and outdoors, which they've been doing. Birth-related records like paternity affidavits, amendments, those will require an appointment to be seen. Birth certificates, death certificates are still being handled by mail or electronically at the moment, unless there's an extenuating circumstance. Again, I would remind everyone, if you have missed your immunization or you have a child who's missed their routine immunization recently, please schedule that appointment now. And you can do that with your provider or at the public health clinic. The public health clinic's number is 812-353-3244. Lastly, I would say that anyone who is involved in the protest or rally or any other large gathering, especially when social distancing isn't maintained, face coverings aren't used, it's encouraged to monitor for COVID-like symptoms and get tested at the first sign of any symptoms or after 5 days. On 6/15 of the Optum sites will no longer have any restrictions on testing. So you will still need to make an appointment, but you will not need to have symptoms or fall into any special category. So again, with that, we would just encourage people to all continue to practice social distancing, wear those face coverings so that we can limit our exposure. If you do feel like you may have been exposed, you have any symptoms, stay away from others, but do arrange for testing at one of our local testing sites. Thank you.
All right, thank you, Penny. And now to IU Assistant VP for Strategic Partnerships, Kirk White.
All right, good afternoon. Yesterday, Indiana University announced our return to campus plan for Bloomington and really for all 8 campuses. And I've pasted a link to this plan in the group chat. I'll go through some of the main points because it outlines the timeline and the phases of reopening and returning to the campus. The return to campus guide has a phased return approach. There are event planning considerations listed as well. We should consider the guide as really a resource for everyone to use as a guide with details about how to restart your class, how to visit the campus. Of course, in general terms, I could say that our phased approach to return is more conservative than the state and even the local regulations at this point. And I'll go through some of those dates here in a minute. But also included in the guide is health and safety guidelines, and employee training, personal protective equipment guidelines, distancing, screening, how to get tested, guidance for physical spaces, including our classroom spaces, transportation and logistics, our transportation system, buses, to that sort of thing, and travel, business travel particularly at this point is severely restricted both in state and of course out of state. For the timeline and the phases, the campus technically now is, we haven't really closed the campus, but it's heavily restricted right now. But as of 1 July, the campus will be open with limited access in some buildings. In 1 August, the campus will be open and most buildings will be unlocked. In-person services will be open at that point. By the 24th of August, the campus will be open on a normal schedule. Back to 1 July, some employees will be called back as needed. By the 1st of July, student-facing services will be called back. Those employees will be back at work. But in general terms, if our employees can work remotely and still accomplish their missions, then we expect them to limit visits to the campus in order to limit the overall exposure levels. Visitors are not permitted to the campus unless there's some unusual reason for them to be there until the 1st of August. And at that point, it will be limited to campus. Their visitors will be allowed to visit campus buildings as of the 1st of August. Up till the 1st of August, it will be outdoor visits only. And on the 19th of August, then, is our scheduled move-in for the residence halls. And at this point, as of the 1st of August, recreational facilities will be allowed as long as their activities are with in accordance with public health guidance. So that's the general overview of our phased return that runs into next semester. And as I say, I put the link to that on the chat so that you can take a look. Thank you.
Okay, and that is on the IU website devoted to all this too, fall2020.iu.edu. So we do have some questions that are coming in. Allison, did I skip over you?
That's okay. I do have one announcement to make, and it is in regards to one of the questions. So we'll kill two birds with one stone and start questions
Absolutely.
while I make my one and only announcement. How about that, Chuck?
Okay, so you want me to go ahead with the questions, or you want to go ahead?
It doesn't matter.
Why don't you go ahead and then we'll start into questions.
Sure. I would like to announce that we do still have the June 23rd blood drive. There are still spots available, 30 around. Right before the press call, I checked, there were around 30 slots still available. You can register at the redcross.org website. That information is also on the county website with directions on how to register. They are giving a $5 Amazon gift card for those that do in fact register and show up to donate. So that's an exciting incentive, as well as anyone that does make a donation. The Red Cross just announced that they are screening those for through the antibodies testing for COVID-19, just as an added bonus to those that are making that donation. So a couple different incentives for those people that are willing to go to that June 23rd blood drive. It is being sponsored by the Board of Commissioners, and it is anyone can register and make the donation. We do have a huge shortage of blood in our area, and so we are encouraging those that can to go to the website, make an appointment, and then of course make that donation to help those in our community. And that's all I have, Chuck.
Okay, thank you. I always follow the list directly, and somehow I skipped your name. This is my fear every week when we do this. We do have some questions that are coming in. So first of all, from Dave at the B Square Beacon, for Penny Caudle, what's an example of the kind of bar supplies that will have to be protected from contamination? Is this olives and maraschino cherries or napkins and straw?
Thanks for that question, Dave. It will depend a lot on the bar itself. It would be all of those things. So a lot of bars, they've got their barware, their glasses. They may have the garnishes and those kinds of things. And they can provide that barrier, that space, that protection in many different ways. It could be a physical barrier, could be by space, that they move those things, they redirect them. They cover them in some manner. So we did want to leave businesses some flexibility, but if you've been seated at any bar in a restaurant, there's usually lots of supplies from glasses to garnishes that are out.
Okay, again, for Penny, how is recruitment coming along for the June 23rd blood drive? Are there still slots open? I think we addressed some of that already.
10 slots.
There are around 30 slots still open, and I did give those directions on how to register for that.
Okay, so this one for Mayor Hamilton. How is 2021 budget planning coming along? Any initial impressions you can share? If a resident has an idea for saving $100,000, what's the best way to communicate that to administration?
Well, let's start with that last one. Shoot me the ideas, send it on into the to the office of the mayor, or via our website or phone. You're welcome. We welcome all such ideas. Yes, the 2021 budget planning process has begun. That's a multi-month process that leads to August presentation to City Council, and typically adoption within a couple months after that. There is a lot of uncertainty this year. We've already seen major reductions in revenue in a couple categories: the gas tax, which comes monthly, and the food and beverage tax, which also comes monthly, have both shown dramatic reductions because of the changing economy and ways of life. We are definitely watching for property tax and income tax effects as well. Those will be much more measured and kind of scattered over the future years, but they're making us be very attentive to the budget needs. And we'll be talking a lot about that in August. I'll probably be giving a major speech about it in a few weeks too, if you want to stay tuned to that. But send your ideas, bring them on in. We welcome them. Thank you.
Okay, from Ethan Burks, WFIU, WTIU, again for Mayor Hamilton. One of the main requests coming from the protesters last week and ongoing is to defund the police. Do you think there's an opportunity to re-examine what Bloomington is spending on police staffing and equipment and see where it could be more effectively used? Is the city willing to open a dialogue with protesters on this? And there's another part to that I'll get to in just a moment.
Okay. Well, absolutely. These are, of course, powerful times to re-examine all of our public safety efforts here locally, across the country. The protests, the activism, the engagement is very serious, very understandable, trying to make sure we're continuing to address the legacies and the current impacts of racism in our community, as well as our country. Absolutely, we are looking at all the activities as well as budget priorities. In addition to the pressures from the economic slowdown, we'll be looking at how we can be most effective in protecting public safety. Again, I'd encourage people to come, if they're interested, to the Tuesday Board of Public Safety meeting at 5. It'll be a virtual meeting. I think there may be a city council meeting as well. They have a standing committee on public safety that's been created that may hold a meeting this coming week as well to consider all kinds of ideas. I'll just mention, in 2016, the city undertook a very extensive review of police procedures following the 21st Century Policing Report that the Obama administration promulgated after the Ferguson, Missouri activities and results. And we went through all 80 plus recommendations at that time with a lot of extensive public review, adopted all but one, which we still have not adopted, which was a recommendation for taser use, which we do not have in the city for a variety of reasons. There's also a website called 8 Can't Wait that's focusing on 8 key protocols important to public safety. We will be reviewing that again. We've been very active in that, and 7 out of those 8 are already in place in Bloomington and have been, but it's always good to review them, reconsider them. And I look forward to that, as well as the priorities, the kind of priorities in a police budget that have adjusted through time. And, you know, when we hired a social worker and 2 neighborhood resource specialists in the last budget cycle, we're going to continue to look at the best ways to protect public safety that is fair, representative, and all ideas are on the table. Happy to talk to anybody about it.
And if you have that $100,000 idea, the mayor's office email is mayor@bloomington.in.gov, phone number 812-349-3406. Another question from Ethan Burks for you, Mr. Mayor. Yesterday, the city terminated its contract with Ken's West Side Towing and Service after one of its employees posted a racist video on social media. Can you talk about what went into that decision?
Yes, I think what I can say about that is, you know, we expect all of our contractual relationships to work with the city, work well with the city. That contract provision allowed us to exit the contract within a 7-day notice period, which is what we executed yesterday. We thought that was the right thing for our community to do, and we'll continue to take steps as appropriate for that.
Okay, for Penny Caudle, what kind of communication has the Monroe County Health Department had with MCCSC, specifically about safety guidelines in schools? What do schools need to do between now and the start of the upcoming school year, and who will have the final decision on reopening?
Well, the schools have guidance from the CDC and the Department of Education, and that's where their primary focus is, and the guidance is laid out. Each school will be different. Obviously, they have to look at options for how they can provide instruction to their students. And it has to be flexible because we don't know what will happen this fall, late summer, next winter. So they really have a very complex job to do in terms of planning. All of the schools are in the midst of doing that now. In terms of MCCSC, we've joined their work team on that. They've asked us to be on that. We are in communication with other schools, participating in some of their planning meetings and work groups. But we have a lot of schools in this community. So we've got, a couple large school corporations, but we also have other small schools. So we want to be able to help all of them to the best that we can. The local health department isn't approving any plans, so they will develop their plans based on the guidance from the Department of Education and using CDC guidelines and any state guidelines. The state health department and the DOE they're working very closely on that guidance so that everything can be met. And the guidance is also kind of living and very fluid. So as information changes, it's going to change. And that's why the schools have to be very adaptable, as we all do in this pandemic. So we're working with each one of them. We are planning to have kind of try to bring everybody together for at least one discussion so that if they have questions of us that are all the same, we can try to work through that and provide some answers. But for the most part, the health department will be involved if they need to close for a period of time, determining how long they need to close, those kinds of things. And that will be in their plan, but it will also be a case-by-case situation to some extent.
Okay. From Emily Ernsberger from the Herald Times for Mayor Hamilton, a question much of the public has been asking: what is the difference between terminating the contract with the towing company versus certain farmers market vendors?
Well, thanks. This does get into the legal world of the care with which a government needs to take in terms of dealing with First Amendment rights and others. That's certainly been a big issue, as people know, in the farmers market. It depends on the specifics of contracts. It depends upon the specifics of actions, and there is litigation going on and some of that. So I probably need to be careful, but absolutely, we continue to focus in all of our relationships to make sure that we do both protecting as far as possible the community's values in all that we do, but also reflecting the rights of individuals to hold viewpoints that may or may not be something that most of us agree with. And they can be complicated. I'll confess that right up front, but we try to follow the guidance of our lawyers and take the right steps that we think we can. We'll continue to do that. I will just add, look, we've talked about the rally and the march and the intensity of feelings, as many of us have found the personal offensiveness of watching videos and knowing that represents just a tip of the iceberg of racial conflict that remains, abuses that remain. We are going to be working very hard together as a community to keep finding ways to improve our community and its justice and fairness and racial equity. I was really proud of the way Bloomington stood up last Friday, a week ago, for those values and represented them very well, even with a fully masked march and advocacy, as well as peaceful. And seeing our community we've had, I'll knock on wood, virtually no vandalism as people have focused on making things better. And we have a lot of work to do on that. And I'm really proud of our community's energy about it and focus on it. And we look forward to continuing to work together on it. Thanks.
Okay. We did start 5 minutes later this week, so I will vamp for just a moment here. If there are other questions that you do want to submit, but next week we do intend to start at the normal 1:15 time, and we will send out that information next Friday morning. Going once and twice, if I don't see any other questions, we will end it there unless Penny, you have something to add?
Well, I think I saw another question about voting, and so I'll take that if that's okay.
Sure.
We did communicate early on with our clerk's office about how they could handle voting and make voting as safe as possible for individuals. Obviously, there's federal and state guidelines and direction about how they do that as well. But they did communicate with us. We had lots of conversations about how they could do that safely. And I think they did a very good job of doing that. And, you know, the county provided masks for people who didn't have one. There was good social distancing. I think they put in all the precautions that they could. And they will continue to do that for the fall. I would still encourage, and, you know, I may be stepping out of I don't know what the fall will bring, but I would still say that voting by mail is the safest thing that you can do. So if you have that option, I would encourage people to do that. But the county and our clerk's office will make sure that people can get to the polls in the safest manner possible.
Okay. All right. I think we have answered the questions we got. Again, we will see you next week at 1:15 right here. Thanks, everybody.
Thank you. Be well.